Let's hear now from Sajid Javid.
Well, since we learned about Omicron, our strategy has been to buy time to assess it, but also to build our defences. And by far and away, the best way to build our defences remains our booster programme, and it's great to see so many people coming forward. We've now over 29 million people across the country boosted, over half of adults, and hitting new records every day. But we do need more people to come forward and keep building the defences for themselves, for their loved ones, and for their community. Today's announcement is about further building those defences by the contracts that I've signed today, which are for 4.25 million additional doses of antivirals. These are special drugs that have been developed specifically for COVID. They're particularly valuable to those that are vulnerable to COVID than others, those that are immunosuppressed. It will certainly help to keep lots of people out of hospital. And this 4.25 million additional doses is on top of the 730,000 we'd already purchased, so almost 5 million doses now, and that's fantastic defence. And also for those people that may be listening that are over the age of 50 or are particularly vulnerable to COVID that test positive, they can sign up to a national study to try and access these antivirals, and that they can find more details on panoramictrial.org.
Do you think they'll play a significant role in not having to resort to lockdowns, these antivirals?
I think these antivirals are significant new defences. Of course, we haven't had these before. One of these antivirals that's already been approved by our regulator was quite recent, and so it's the first time we've got this type of defence as well. But when you add this alongside what are called the monoclonal antibodies that I saw here being offered to patients that were vulnerable here at St. George's Hospital, alongside the booster programme, these pharmaceutical defences, you're taken together, are a huge new way to defend ourselves against COVID.
Thank you. On the new guidance surrounding self-isolation, it's quite clear that after 7 days, the advice is that people should avoid poorly ventilated spaces. They're advised to work from home. What does that mean for care home workers? Can they go back to work after 7 days? You know, they'll be coming into contact with vulnerable people. What does it mean for them? Can they go back to work?
These new self-isolation rules, so the people that are self-isolating, as long as they test negative through a lateral flow test on day 6 and day 7, taken 24 hours apart, they can leave isolation. If you are someone that works in a care home or the NHS even, you can return to work. But of course, those people will also be following the rules that are set by their workplaces where they test regularly. So I know that for hospital staff, that means that they will be asked to continue to test on those other 3 days as well.
How does this cut to the self-isolation rules help the economy when, clearly the recommendation is that people spend 3 days after that 7 days in self-isolation working from home? Does it help in that capacity at all?
Well, the working from home recommendation is there anyway. If you can work from home, not everyone can, for those that can, that's something that's clearly is government guidance already, whether you are self-isolating or not.
We're expecting more data, of course, on Omicron and its severity. Are you optimistic about that data, and when can we see it? When do you expect it to be released?
We're learning about Omicron all the time. We know that it's significantly more transmissible than the Delta variant. We know that 2 doses of vaccine aren't quite enough to help you, but 3 doses are, so please come forward if you haven't already. But in terms of severity, there is analysis taking place. That analysis isn't complete, but I do look forward to receiving it.
But you've reportedly lost the argument in Cabinet about new restrictions over Christmas. In light of the actions taken by the governments in Wales and Scotland, do you think the data might justify new restrictions?
We keep the data under review at all times. It is fast changing, the situation. There's more data, not just here from home, but from abroad. We keep an eye on all that data and discuss it with our expert advisors. And as the Prime Minister has said, whilst there's no need for any further restrictions before Christmas, we will certainly keep the situation under review.
Just one more if I can. Of course, yesterday the PM said what he said about Christmas restrictions, but now the attention is turning to New Year. What should people do at New Year? How should people plan their lives for the start of 2022? When will they get that certainty?
Look, this is an uncertain time. I think everyone can see why. This new variant has come along, and I think it's right that we are all responding to it in the best way that we can. The government has issued guidance. There's been the Plan B that's been brought into place, but we'll keep it under review. But the best advice to everyone is continue to remain cautious and keep looking forward to Christmas. And as the Prime Minister said, no new restrictions before Christmas, and beyond that, we will just keep the situation under review.
Can I sneak in one more? Where is the Prime Minister? Is he hiding?
The Prime Minister, he couldn't be working harder than he is. I mean, I'm having meetings with him probably 2 or 3 times a day, and I know he's taking many other meetings and focusing on so many other challenges that the country faces.